Hi, everyone. I'm pleased to welcome you to today's webinar, End of PHE, Prepare Now to Avoid Uncompensated Care. My name is Melissa Zuro with the Civista marketing team, and I will be moderating today's session. Today, we'll be sharing important information about the ending of the PHE, what it means to patients and providers, and provide useful education and best practices to mitigate risk during this transition. Our presenter today is Amy Newson, Senior Director of Revenue Cycle Solutions at Civista. Amy has extensive experience managing patient eligibility services for acute care hospitals, in-depth knowledge of eligibility requirements at both state and federal levels, and extensive experience providing access to care to the most vulnerable community members. This webinar will be recorded and made available to you for future viewing. You will also have access to the presentation slides. Thank you so much for joining. And now I'm going to hand it over to Amy.
Thank you, Melissa. Well, it's really nice to connect with everyone today. So wanted to just briefly provide you, who Civista is. So we are Civista. We have 30 years of experience across the revenue cycle, and we offer a wide range of services to solve revenue cycle challenges. So with that, I'm going to go through today's agenda. We are going to review the public health emergency and what it means regarding the continuous enrollment requirement update. We'll talk about the impact with the continuous coverage ending, and then we'll also identify best practices to minimize loss of coverage. So talking through the expiration of the public health emergency, which is creating mass disruption of Medicaid coverage. So I want to be able to go over a little bit of history. In March of 2020, the Congress had passed the Families First Coronavirus Response Act, and this allowed states to receive the enhanced federal match provided that they maintain continuous coverage for most people enrolled in Medicaid until the end of the federal public health emergency. As a result, Medicaid and CHIP had expanded to 89+ million people. Medicaid recipients then maintained continuous enrollment under the public health emergency, and states enhanced federal Medicaid funding match by 6.2%. The public health emergency had several waivers in it, some which included the reimbursement regarding COVID tests and vaccines, telehealth with key focus on Medicare beneficiaries, and what we're all here today discussing, that continuous Medicaid coverage requirement. In December of 2022, Congress passed the 2023 Consolidated Appropriations Act, and this separated the continuous Medicaid coverage requirement from the federal public health emergency, ending continuous enrollment on March 31st, 2023. So as the states, they could then begin disenrolling members who are no longer eligible as early as April 1st of 2023. Subsequently, the Biden administration announced that the public health emergency will end on May 11th of 2023. And the enhanced federal Medicaid matching funds would be phased out through December 31st of 2023. By ending the continuous coverage, about 18 million Americans may be booted off of Medicaid. So there was a survey that was done as recent as February of 2023 that more than 60% of Medicaid recipients are unaware of the redetermination requirement. States have plans in place regarding the ending of continuous coverage, leveraging anywhere from the 12 to 14 months to end that continuous coverage and resume their regular renewal redetermination process. You'll most likely find out how the states are handling the end of continuous coverage, state specific, on your state Medicaid websites. It is important to know that when your state will begin disenrollments as well, to help you understand and plan for any potential impact. Just to give a high-level overview, there's actually 5 states that began disenrollments in this month, in April. There's 14 that'll begin in May with disenrollments. There's 22 that will begin in June, 9 that will begin in July, and 1 that will be in October. So what does that mean with impact on patients and providers? With the continuous coverage ending, the immediate effects will be for those patients that have high utilization or services or use of services frequently, and long-term patients may forego treatments due to the lack of coverage, and they may enter the healthcare system at a higher level of acuity. Providers can expect an influx on patient phone calls and ED visits. Providers may also see an increase in the self-pay volumes, which would shift their payer mix from Medicaid to self-pay, and potentially increasing bad debt. There also may be patients that are presenting with renewal information or letters they receive from the state, or they're just coming and asking questions in general, and they may need assistance with that information. It could place a lot of pressure on provider staff to be able to help assist with those questions and understand how to answer them, as well as re-enroll them into Medicaid or a different payer source. We recommend that knowing your targeted audience and potential impact financially is really key in identifying what actions to take to mitigate the risk. Some examples we would recommend is really looking at your upcoming high dollar scheduled patients, such as surgeries or infusion treatments, or review your historical high utilization patients that came in frequently over the past year, to understand what that potential volume and future financial impact could be if that patient were to lose coverage as they continue to receive services. Steps that providers can take to mitigate risk are: partner with your state, your community leaders or consumer groups to assist with redetermination process. Learning how your state is communicating and handling renewals can arm you with how you communicate to your patients. Also, there's a lot of great webinars that the states have done and have posted on their websites that can help as well. Reach out to your Medicaid payers. See if they have renewal listings of those patients that were seen at the providers. Or seen at clinics and facilities, and see if they'll be able to share that information to understand who is due and when they're due, because that could also help with prioritizing the renewal listing and how you handle patients. Patient education is key, so communication. I'm a big believer that over communicating for everyone to hear and retain. I would say I got to hear it 7 times to know it and speak it. So getting communication out is really, really big. We know that patients are going to receive, or Medicaid beneficiaries in general, are going to receive communication from the state. They're going to receive text messages. They're going to get emails. They're going to get letters. They're going to receive communication from those managed care organizations. They're going to hear it on mainstream, on the news channels, or see it in social media. But as a provider, having that communication as well from your key department is so important to ensure that the patient takes the necessary steps to continue their coverage or shift to a different payer. Providing the education through leveraging you could leverage state flyers. There's a lot of communication toolkits on the state websites, or even create flyers to leave at key areas for patients to take with them. We recommend, when it comes to communicating with patients and creating flyers, really some key items in the flyer. Basically explaining what continuous coverage ending is and how it affects the patient's benefits, understanding what benefits are, getting impacted, such as Medicaid, CHIP, which is the Children Health Insurance Program, or even other programs such as food stamps. Providing resources for patients to connect to, such as their local state office, encouraging them to check their benefits, update their contact information with their local agency, and respond to any mail that they may receive from that agency, and ensuring that they respond timely. We also provide a checklist to have handy for the patients to obtain key verifications that can prepare them if in the event their agency requires information, such as income and resources. And then the third way is leveraging a third-party partnership, actually performing services to help active Medicaid beneficiaries to proactively help them with their renewal with the state, or if they're not eligible, help them to move into a different coverage option prior to them becoming a self-pay patient. So our strategy for minimizing loss of Medicaid coverage. So we believe that providing provider education is key here, providing it to all the key stakeholders, the departments. We provide recorded webinars, lunch and learns, live sessions, but just being able to educate anyone and everyone that may work with the patient and understanding how continuous coverage is ending and how that impacts the patient's benefit. Patient education. So in addition to all of the state's plans to reach out to the current members, we provide materials for providers' websites informing patients about the end of continuous coverage. We provide one-page handouts for patients that would let them know what that means, what the continuous coverage ending means to them, how they can contact their state, and the options if determined ineligible. And then we also have a checklist of how the patient can be proactive to ensure continuous coverage if they're eligible. We partner with the state agencies, the local agencies. It's important to stay abreast of new developments in the market and coordinate with the state to identify their policies and planning as a community partner to further educate our clients and create action plans as needed to mitigate the risk. We also look at identifying what is the high-risk population to provide actual services. So being able to provide services such as focusing on targeted outreach for recurring patients and having strategic outreach efforts. Outreach can consist of sending letters or mailers to patients, educating them, and having them contact us for actual service to help them. Dialer outreach, texting, email campaigns, field visits, as well as manual calling the patient to outreach. We can host both virtual and in-person enrollment fairs and partner with all the different agencies to coordinate, as well as our providers. We can review the Medicaid status and ensuring that we're looking at eligibility verification and understanding when that Medicaid beneficiary's renewal date is due. And then once we actually have connection with the patient, we screen that patient for assistance, leveraging our screening tool and identifying, do they still qualify for Medicaid? And if in the event that they do not qualify for Medicaid, what are other programs that they could qualify for? Maybe it's moving into, we see that they could possibly move into a different program within Medicaid. Maybe it's moving into Medicare because they've aged to Medicare. Maybe it's looking at the employer coverage opportunity, or even looking at moving into a qualified health plan through the marketplace, where there's a lot of really low premiums and different insurances out there through the marketplace that are pretty affordable. So we would also, if they do qualify for Medicaid, we also obtain that information. And we would just help ensure that we're working and coordinating with the state as an authorized representative, providing supporting documents to the state, and then obtaining any signatures, electronic signatures, or verifications as needed, and following that Medicaid renewal through approval. We do provide our performance through reporting metrics, such as our contact rate, our application rate, the approval rate, as well as reviewing a recurring conversion rate. Some additional support, we actually do offer free risk assessments to identify what the financial impact could be for our providers. To be able to, understand where to target if there's opportunity to have a specific targeted outreach to working with active Medicaid beneficiaries that will be due for renewal. So at Civista, we created a Patient Debt Awareness Day to bring much needed focus to the growing problems of medical debt for patients and uncompensated care for providers. We encourage you to visit our website at patientdebtday.com, where you can find key resources to arm and educate you and identify ways to support your patients. And this is just a visual of what you'll see when you access the Patient Debt Day. Here we have guides about the public health emergency ending and information. We have information on our actual eligibility enrollment services, which includes recurring enrollment services. We have case studies, as well as a white paper regarding patient balance management services to help assist the patient holistically with all of their bills, with multi-services that include not only financial assistance and eligibility enrollment, but also collections as well. We have information for the states if you need to access to understand what your state is doing or understand when they're going to disenroll Medicaid beneficiaries. You can access that information here as well. And then we also are providing our checklist in both English and Spanish that can help prepare the patient, and it's just education that you can leave at your key patient areas for the patient to have so that they can prepare to be proactive regarding their coverage. We're also listing here a few web articles, sharing some of the public articles. One is related to the majority with the members not knowing about redetermination from Becker's that we mentioned earlier. And then also KFF has great information regarding the 10 things to know about the unwinding of continuous enrollment provision, as well as several links that link to CMS and the planning and understanding how the states are handling continuous enrollment ending. The other thing that I want to leave you here today with is how providers can plan for the unwinding, of the public health emergency, of the ending of continuous coverage. And you can take two different approaches here. One is resume your current process today and just have a little bit of, information and planning. What does that mean? Well, I would plan for if there's no proactive measures, for your current patients, I would look at ensuring and planning for potential increased self-pay over the next 12 to 14 months. I would definitely ensure that you identify the month of disenrollment with the state just to plan for that potential impact with your patients. And then upon registration, when the patient is coming in, I would definitely check the eligibility verification system to identify the active coverage of that patient. Some systems, depending on the state, some eligibility verification systems actually show the renewal dates and when they're due. Others may need to actually ask the patient or the enrollee when they had their first month of eligibility to identify when they may be due for renewal again. The reason I say that is that some states, the way they're prioritizing the renewal dates is based on when they were renewed initially, right? There's a lot of different plans regarding their phases and approach, but it's always good to know when the first month of eligibility was issued to kind of gauge when their renewal may be due. Also asking the patient when they first obtained Medicaid coverage, just to gauge that information. I would also look at distributing information, education, informing and educating the patient about the changes and what it means to them, providing resources that the patient can contact regarding their coverage. The right-hand side here is really taking steps for proactive planning. So informing patients on key steps to take regarding their Medicaid benefit. Use some leave behind cards and mailers for patient contact. Create patient scripting for consistent conversation points. Update contact, ensure that the patient updates their contact information with the state. Ensure the patient is checking mail for notices and responding timely for those local agency notices. Completing the renewal redetermination information and providing the requested verifications. Also, understand what the impact means to you as a provider. Identify targeted outreach opportunity for patients that are high utilization. Inform key departments about, the ending of the public health emergency and the continuous coverage ending, which can include patient access, care management, or billing. You may have potential denials. So how do you prepare for that, right? Understanding renewal dates for the payers. Conduct eligibility verification checks, review if systems such as Epic, you have financial assistance modules. If you're already capturing that renewal data, be able to pull that data to identify priority for contacting patients, because you do not want to prematurely renew somebody into coverage, or it could be a duplicate request with that agency. Or, be able to verify the original Medicaid enrollment date when you're checking your eligibility online. Help that patient through the process of renewing their benefit. So knowing how your state is handling those premature renewals, making sure you don't do it, too early on, that you're doing it within the time frame that the state is requiring. Could be 30 days, 60 days, 90 days. It's very dependent on your state. Knowing additional programs to support the patient enrollment in, or whom to send the patient to if they're no longer qualified for Medicaid, such as Medicare, employer-sponsored coverage, qualified health plans through the marketplace, financial assistance, or self-pay payment plans. And that concludes our presentation today. I wanted to ask if there was any questions.
Thank you so much, Amy. That was a wonderful presentation on uncompensated care and PHE and all the great tools that are available for providers to use. We did have a couple questions come through. If you do have any questions, feel free to email Amy at amy.newson@civistarcm.com. So the first question is, how can you improve the consumer experience for individuals applying and renewing a health coverage during the unwinding of the PHE?
That's a great question. I would say that knowing your state's plan and providing education, in addition to your processes as a provider with the ending of continuous coverage, it will increase that consumer experience. I would recommend that communicating with your patients prior to them losing coverage, and sharing resources for them to, contact to help guide them regarding their benefit and ways they can mitigate risk. It could all help with increasing that consumer experience.
Oh, wonderful. Can the marketplace coverage be backdated or started retroactively?
So I'll take this in sort of two different answers here. One is in the event the patient loses coverage, let's talk about Medicaid first. So Medicaid. If it's related to the continuous coverage ending, some states actually allow for 90 days post the denial of that eligibility to be able to re-provide the information that was due. And then that beneficiary, that Medicaid beneficiary, can actually be reviewed and placed back on Medicaid. Now, there is some risk with a gap in coverage. It is dependent on state and if there was services that were incurred. For new applications, continuing on the Medicaid approach here. For new applications, it is dependent on the state if there's prior coverage offerings. Some states offer 90 days retro coverage if there was a medical event, and others do not. It just depends on the program that they qualify for in Medicaid and what those state rules are. And when I talk about the marketplace, when it comes to insurances, most enrollments, new enrollments, they're completed during open enrollment time, which is around November, and usually they're effective January 1st, right? But if they're enrolling due to a qualifying life event, so in this situation, they lose their Medicaid coverage and they're enrolling due to a qualifying life event, the effective date rules, they do vary depending on what their circumstances were around that qualifying life event. So it can vary. I would say that if someone is no longer qualifying there, it is really, really important. If they're no longer qualified for Medicaid and early on, you can actually start the process like 60 days in advance before that recipient loses coverage by looking at helping them to enroll into a qualified health plan. So when they do lose their coverage, they actually can start their qualified health plan insurance going forward.
Great, thank you, Amy. Well, we're coming to the end of our session, so we'll be wrapping up for today. If you have any additional questions, feel free to reach out to Amy and at the email address on the screen, and we'll be providing written answers to all questions following the webinar. Thank you, Amy, for presenting today, and thank you for everyone for joining. Please visit patient.day.com, where we will continually add additional resources for you to navigate the unwinding of the PHE. Have a great day. Thank you.
Thank you. Have a good day.